In December 2022, for the first time in history, thousands of nurses across the UK went on strike, demanding fair pay and improved patient safety. St Thomas's was one of 5 London hospitals to take part in the strike.
This is a historic strike. Nurses are out here today to raise the awareness for safe staffing levels. Obviously, there's an element to do with fair pay, but we're seeing lots of experienced nurses leaving our profession. We're seeing lots of newly qualified nurses who are joining the profession also leaving because they're not being supported. Our services are chronically underfunded and we have unsafe staffing levels every day. So we're all out here to highlight the issues and to get a fair pay.
What do we want? Fair pay! What do we want it? Now! What do we want? Fair pay! When do we want it?
In a winter when we're worrying about COVID, flu and strep A, on top of COVID backlogs, I am deeply concerned about the risks of strike action to patients, said Health Secretary Steve Barclay.
I think what's really key to this is that we're doing this in a really safe way. We're maintaining safe services so that we can be out here.
There is a lot of feelings that have been suppressed, fatigue, burnout, anxiety, stress, because it was a very hard time during the pandemic. It's something that we all have never seen, so and we worked very hard. We dedicated ourselves to making sure that people were coming out safe and we were recovering people and protecting our own health and safety in our families as well. And that's all we want. We want safe care for our patients because it's getting dangerously unsafe for nurses right now, and it has been for a long time, but we've still been giving it our all. And so all we want is just for the government to hear us, to understand why we want fair pay. I don't think it's an unreasonable request and unreasonable thing that we're doing today. It's unfortunate that we had to get to this point, that we have to strike. Do we want to? No. Do we like it? No. We don't like walking out on our patients or coming to work and say, I'm not working today. It's not something that we are choosing to do it, but we have to do it, for our own safety, for the patient's safety, for the people, for the public.
To give support and solidarity to what is already a very big protest of nurses, but also I think you're going to see today other trade unionists and actually the general public coming to give support.
I think people are tired, they're burnt out. We've had 3 grueling years of COVID, of redeployment, of going to work in areas which are unfamiliar with, working above and beyond, and yet our real terms pay is going down. So people are fed up, people are burnt out, and it's only going to get worse if we don't do something.
Steve Barclay claims the 10% pay rise is unaffordable, resulting in another historic moment for the NHS. On the 6th and 7th of February, nurses and ambulance workers across England went on strike in what is the NHS's biggest industrial action.
I think the government really need to reevaluate how they view the National Health Service and where they prioritise their funding. As we've seen in the last 3 years of the pandemic, the NHS has provided a service above and beyond, and when they have PPE contracts that are putting cash into their mates' back pockets, they need to really evaluate their priorities. I think the goodwill within our profession is dwindling, and I think if something was to happen like the pandemic again, and they were to come and knock at our door, that door wouldn't be answered.